Your liver works 24/7 to filter toxins, digest food, and keep your body running. But when it starts failing, the warning signs aren't always obvious. Ignoring them could be dangerous. So here's what you need to know. Liver disease doesn't happen overnight. It often starts with subtle changes: yellowing skin, unexplained fatigue, or swelling in your belly. These signs might seem harmless at first, but they could point to serious liver damage. In this video, we'll break down the key symptoms of liver disease, why they happen, and when to take action. Let's get started. The liver is one of the hardest working organs in your body. It filters toxins from your blood, produces essential proteins, and helps digest fats by making bile. It also regulates nutrients, stores energy, and plays a key role in your immune system. Without it, your body wouldn't function properly. But when the liver is damaged, it struggles to do its job. Waste and toxins build up, digestion slows down, and your blood may not clot as it should. Over time, this can lead to serious complications. The problem? Liver disease often develops silently, with symptoms appearing only when the damage is already significant. That's why it's crucial to recognize the early warning signs. Some symptoms are easy to miss, while others might seem unrelated to liver function. Let's take a closer look at what your body might be trying to tell you. Jaundice is a yellowing of the skin and eyes caused by a buildup of bilirubin, a waste product from the breakdown of red blood cells. A healthy liver processes and removes bilirubin through bile, but when liver function declines, bilirubin accumulates in the bloodstream, leading to visible discoloration. The first sign of jaundice often appears in the whites of the eyes, scleral icterus, before spreading to the skin. It's commonly linked to liver disease, bile duct blockages, and severe infections. Jaundice may also be accompanied by dark urine, pale stools, fatigue, and abdominal discomfort, depending on the cause. Since jaundice signals underlying liver issues, it should never be ignored. If you notice yellowing of your skin or eyes, it's important to seek medical attention to identify the cause and prevent further liver damage. Liver disease can cause ascites, a buildup of fluid in the abdomen, and swelling in the legs and feet, peripheral edema. This happens because the liver produces albumin, a protein that helps regulate fluid balance in the bloodstream. When liver function declines, albumin levels drop, allowing fluid to leak from blood vessels into surrounding tissues. Ascites often causes a bloated or distended belly, while peripheral edema leads to swollen ankles and legs. In severe cases, the excess fluid can make movement uncomfortable and even affect breathing. Ascites is a sign of advanced liver disease and often occurs with portal hypertension, a condition where increased pressure in the liver's blood vessels forces fluid into the abdomen. If you notice unexplained swelling or a sudden increase in abdominal size, it could indicate serious liver problems. Medical intervention is crucial to manage fluid buildup and address the underlying liver condition. The liver plays a key role in producing clotting factors, proteins that help stop bleeding when you get injured. When the liver is damaged, it produces fewer of these essential proteins, making it easier to bruise and bleed even from minor injuries. People with liver disease may notice frequent bruising, prolonged bleeding from cuts, or even nosebleeds and gum bleeding. In severe cases, internal bleeding can occur, leading to blood in the stool or vomit, which requires urgent medical attention. Since unexplained bruising or bleeding can signal serious liver dysfunction, it's important to seek medical evaluation to determine the cause and prevent further complications. Pruritus, or itchy skin, is a common symptom of liver disease, especially when bile builds up in the body. Under normal conditions, the liver processes and removes bile, a digestive fluid. However, when liver function is compromised, bile acids accumulate in the bloodstream, causing skin irritation and an intense, persistent itch. This itching can affect various parts of the body, including the hands, feet, and back. It's often worse at night and can lead to scratching, which can cause skin damage and increase the risk of infection. Pruritus is most commonly associated with conditions like cholestasis, cirrhosis, and bile duct obstructions, which block or slow the flow of bile. If you experience persistent itching, especially if it's accompanied by other symptoms like jaundice or fatigue, it's important to consult with a healthcare provider to address the underlying liver issue. Palmar erythema, or red palms, is a condition where the palms of the hands appear unusually red. This occurs when there is an increase in estrogen levels, which is often seen in liver disease. Normally, the liver helps metabolize and clear excess estrogen from the body. But when the liver is compromised, it struggles to process hormones properly, leading to higher estrogen levels in the bloodstream. The redness is most noticeable on the hypothenar area, the part of the palm opposite the thumb, but it can spread across the entire palm in some cases. While palmar erythema is commonly associated with liver disease, it can also occur in conditions like rheumatoid arthritis. If you notice persistent redness in the palms, especially when combined with other symptoms like jaundice or swelling, it's a signal that you should seek medical attention to evaluate liver health. Spider veins, also known as spider nevi, are small, red, web-like blood vessels that appear on the skin, usually on the face, neck, or upper body. These tiny vessels radiate outward from a central point, giving them a spider-like appearance. They develop when there is an increased level of estrogen in the body, which is often linked to liver dysfunction. The liver plays a role in metabolizing and clearing excess estrogen, so when the liver is not functioning properly, estrogen levels rise. This causes the dilation of small blood vessels near the surface of the skin, resulting in the formation of spider nevi. While these veins are not painful, they are a visible sign of potential liver issues. If you notice spider veins along with other symptoms like jaundice, fatigue, or swelling, it's important to see a doctor for further evaluation of your liver health. Muscle wasting, or muscle atrophy, is a common symptom of chronic liver disease. When the liver is damaged, the body enters a catabolic state, where it breaks down muscle tissue for energy. This occurs because the liver is unable to properly store and release nutrients, leaving the body to rely on muscle proteins as a source of fuel. As the disease progresses, you may notice shrinking muscles, particularly in areas like the hands, shoulders, and face. Muscle wasting is a sign of severe liver damage and can significantly affect a person's strength and mobility. If you're experiencing unexplained muscle loss, especially alongside other liver-related symptoms like jaundice or fatigue, it's crucial to seek medical attention. Addressing the underlying liver issue can help manage or even prevent further muscle loss. Dark urine and pale stools are key indicators that bile flow is being affected, often due to liver dysfunction. Bile, which is produced by the liver, helps with digestion and gives stool its characteristic brown color. When the liver is compromised, bile production or flow can be disrupted, leading to noticeable changes in urine and stool color. Dark urine, often described as tea-colored, occurs when bilirubin, a component of bile, accumulates in the bloodstream and is excreted through the kidneys. This can happen when bile is not properly processed or eliminated by the liver. On the other hand, pale or clay-colored stools occur when the bile is unable to reach the intestines, leaving light in color. If you notice these changes, especially in combination with other symptoms like jaundice or fatigue, it could signal a serious liver issue that needs immediate medical attention. Fatigue and confusion are common symptoms of hepatic encephalopathy, a condition that occurs when the liver can no longer effectively filter toxins from the blood. The liver normally detoxifies harmful substances, but when it is damaged, these toxins build up and affect brain function. This can lead to feelings of extreme tiredness, difficulty concentrating, and even mental confusion. In the early stages, you may notice general fatigue and a sense of being mentally foggy. As the condition progresses, confusion may worsen, leading to disorientation or difficulty with basic tasks. In severe cases, hepatic encephalopathy can cause more serious symptoms, such as personality changes or even coma. If you're experiencing persistent tiredness or mental confusion, especially alongside other liver-related signs like jaundice or swelling, it's critical to seek medical attention. Hepatic encephalopathy is a serious condition that requires treatment to manage toxin buildup and protect brain function. If you notice persistent jaundice, swelling, confusion, or any combination of the symptoms we've discussed, it's crucial to seek medical advice immediately. These signs may indicate liver dysfunction, and the sooner you address the issue, the better the chances of managing or even reversing the damage. Liver disease can progress without clear symptoms in its early stages, which is why it's essential not to ignore warning signs like dark urine, pale stools, or itchy skin. If you experience persistent fatigue or muscle wasting, these may also be signals that your liver is struggling to function properly. While some liver conditions can be managed effectively with early intervention, delaying medical attention could lead to more severe complications, such as hepatic encephalopathy or liver failure. Your doctor can perform tests to evaluate liver function and recommend the appropriate treatment, which may include lifestyle changes, medication, or other medical interventions. Don't wait for your symptoms to worsen. If you're unsure about what you're experiencing, or if something feels off, getting checked by a healthcare professional could save your health and even your life. To wrap up, we've covered some of the key signs of liver disease, including jaundice, swelling, bruising, and fatigue. Remember, your liver plays a crucial role in keeping your body healthy, so if you notice any concerning symptoms, don't wait. Seek medical advice right away. Did any of these symptoms surprise you? Share your thoughts below. And don't forget to like and subscribe for more health insights. With that said, thanks for watching, and until next time.